Hi, my name is Dr. Udraman, and through the Oral Health channel today we're going to be talking about why within a few hours the stains that seem to be removed during a professional dental cleaning appointment tend to come back. Let's start. So today I'm going to be talking about, it's in lieu of a comment that actually came a few months back by a viewer who said that I got my professional dental cleaning done, but within a few hours my teeth feel stained and it's not the same as I was feeling immediately post-operatively the dental scaling. So there are two answers to this question. The first answer is basically the academic purpose and the informative purpose of the answer that you need to know, and the second answer is the answer that you need to understand. So I'm going to be talking about the answer that you need to know first. It's very simple. When you get a scaling done, I hope the polishing is done for you, because when we do scaling, it does not remove any sort of the enamel layer, but the scaling instrument is known for causing microscopic aberrations that can create microscopic niches for microscopic particles that can stain the teeth after some time that the appointment has happened. Now, most likely the polishing should have happened because of the fact that the polishing is like the buffing of your car after a repainting, right? So when you want to get the scaling done, you need to make sure that the polishing is also done, so that these microscopic abrasions are actually basically taken care of and buffed out or smoothened out, to be very honest. And that's where the propensity of these microscopic particles that may cause staining of teeth post-operatively in your scaling might be stopped in their tracks. Now, secondly, what I would like to really apprise you about is that a lot of patients don't follow the instructions that are given to them to the hilt. What I do with my patients is, for the next 24 hours, I ask them to refrain from smoking. I ask them to refrain from drinking colored drinks, black coffee, black tea, espressos, wine, smokeless tobacco, or even consuming foodstuffs that have artificial colors in them. Why? Because your teeth, after they are cleaned professionally, they are rendered a little bit more active towards taking up substances. So any sort of colored substances or extrinsic stains per se will happen much faster just a few hours after the cleaning processes happen. Secondly, what I would like to say is that most people tend to become, for the next few days after a professional dental cleaning appointment, most people tend to become very conscious of how good their teeth look. Let me apprise you with the fact that it's an eye-opener. Teeth aren't white. Teeth aren't pearly white. The pearly white teeth that you see are probably veneers or caps and all those artificial teeth or makeovers that happened with the Bollywood or the Hollywood smile. Let me tell you something very honestly, that the teeth are usually off-white or yellowish in tinge, and they become more and more yellower as you go from top to bottom of a single tooth towards the root. Now, it's very high likely chance that you are very conscious just post-operatively, because you must be having a lot of stains, and the fact that you've been made rid of that, you've gotten rid of those stains, it makes you more conscious. So in the next 2 or 3 days, you feel that my teeth should still look the same just after they've come from the professional cleaning. That's not how it works. Secondly, now you need to understand this answer, that just like your car or just like your house, whenever you get a professional cleaning done, right, a professional cleaning versus a daily cleaning, please try to understand this in terms of the context of the car or your house. When you get professional cleaners to your house, they make your house spick and span, your bathroom fittings are shining in your face and all those things, and your car is also gleaming in the sunlight. But when you start cleaning your house, because of the fact that no matter how meticulous you are, you don't have the exact tools for that kind of professional cleaning, obviously there is going to be some difference. You park your car outside in the sun, even if you have a paint protection film on it, if there is a windy dust storm or any sort of dust or particulate matter in the air, your car will catch that dust, and that's how your teeth also work. Your mouth is a very dynamic environment, and thereby all the food particles, debris, whatever you eat, it's not that you eat one particular thing every day. It's not the kind of consistency, the kind of saturation of oils and all those things that are present in the food, everything. So it's very different. So your teeth will respond differently to those things. People who drink aerated drinks have a lot of sodas. Now, if you've gotten a cleaning done and then you start drinking sodas the very next hour, there's a high likely chance that microscopically your enamel will get decalcified and it will be more susceptible to uptake of stains. And one more thing, that a lot of people might have stains because of the consumption of food items, or excessive consumption of food items, or tobacco, or stained drinks and all those things. Their stains have become from extrinsic to intrinsic, and the doctor has to apprise you about the realistic picture that your teeth will not go beyond this tinge or intrinsic stained color of the teeth beyond this point. And if you want to get it done, you might have to get a bleaching appointment done. So that's also very important. And last but not the least, because I don't believe in slander of my community, there's a slight possibility maybe the operator or the dentist might not have done a very good job or a very meticulous job, which I rarely doubt, or the polishing may have been missed due to either time crunch or maybe financial issues. So this was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you feel the need to contact me or connect with me, here is my WhatsApp number and my social media handles. Please refrain from calling directly, as I might be busy with patients, and please drop a message so that I can get back to you in some time. If you feel that you have some queries, apprehensions, doubts, comments, suggestions, criticisms, please feel free to do so in the YouTube comment section. So that's it for today. Thank you.